So according to the Women's Health Organization, data is suggesting that polycystic ovarian syndrome affects 1 in 10 women of childbearing age. We're joined now by a clinical nutritionist who is a part of a campaign hoping to spread awareness on the issue. Dr. Kimberley Summerville joins us now. Good morning, Doc. Good to have you.
Hi, good morning.
Good morning.
Thank you so much for having me.
Can you please tell me first if we say PCOS or PCOS or is it one?
It's PCOS or PCOS, whichever you prefer.
Okay, copy that. All right, I see discourse a lot more, especially in social around PCOS. Lots of women coming forward to say, I suffer from, I don't want to use the wrong terminology.
I'm dealing with or I'm living with.
Okay. All right. So for the folks who don't know, first of all, let's start by establishing what it is.
Okay. Yes. So PCOS stands for Polycystic Ovarian Syndrome, and it's a hormonal disorder generally affecting women, and that usually starts during their reproductive years. So reproductive years means that when they start their menstrual cycle onwards. So what may occur is that the most common symptom, they may find that they have irregular periods. So we should generally have periods around, say, 12 times for the year, but these women may have it less than 9 or less than 6 times. Sometimes skipping years altogether. And then they may have symptoms like excessive hair growth, excessive acne, or even losing hair on their scalp. Sometimes these women also gain weight and find that it's difficult to gain weight, or even find that they have difficulty conceiving a child as well.
Okay.
I'm curious, sorry, Simone.
Yes,
how does that differ from fibroids? Because I think that there is some kind of misconception about what PCOS is and fibroids.
Can you tell endometriosis.
And endometriosis.
Sure. Okay, so PCOS is a syndrome. And when we say syndrome, we're saying that we have many different symptoms that one can have. And not one woman will have the same symptoms as another who has PCOS. Whereas fibroids, these are actually small tumors or growths, rather, in the uterus. And that's the only place that we can find fibroids. We call them uterine fibroids. This may cause cramping, excessive bleeding, and some women need to be surgically remove either the fibroids or their uterus altogether. Whereas now endometriosis, this is also a hormonal disorder, but what happens is that the lining of the womb that usually sheds each month when you have your period, that is found in different areas of the body. So it may be in the muscle of the uterus, it may be in the stomach, it may be in the lung, causing a lot of pain during the time that these women have their menstrual cycles. So those are the differences.
So the good news about PCOS, if there's any, then, is that it is it fair to say it's a little easier to live with, comparatively speaking, and relatively speaking, and that it can be treated more readily? Is that fair to say?
Well, not exactly, because right now this research on PCOS is still a little bit low. So there's no one specific medication that can treat PCOS right now. Though many doctors use birth control tablets, as well as something called metformin that can help regulating the cycles, these medications don't help everyone with PCOS. So previously, what is found is that lifestyle changes like increasing your activity, managing your stress, eating a little bit less carbohydrates, more vegetables, fruits, protein can help with PCOS. But it's not a one-size-fits-all syndrome. That's why it's a little bit difficult to treat.
Okay, go ahead.
You said metformin for diabetes?
Yes, metformin is for diabetes. So the thing about PCOS is that it has an issue with how your bodies regulate insulin. And because insulin is also connected to the different hormones in the body, when the insulin is dysregulated, the hormones are not regulated either. So we have found that metformin helps with insulin sensitization and hence helps the hormones of many women who have PCOS.
Talk to us about the difficulties that some women face trying to have a child, women with PCOS.
Sure. So as I was saying earlier, most women with PCOS have irregular menstrual cycles. And a menstrual cycle really comes about after ovulation or after they release an egg. So many women don't release that egg. And hence, if you're not releasing the egg, you won't have a chance of getting pregnant. So it's not to say that it is impossible, but it is one of the most common reasons that a woman may be dealing with infertility.
And so you're saying that's one thing. Diabetes, women who have PCOS are at risk for developing diabetes, and also mood disorders. And people may read that and say, I don't know that, but it's serious.
It is difficult, especially the fact that hormonal changes occur, say, around your menstrual cycle, or if you're not having any menstrual cycle at all, you may continuously have this issue with just feeling low, feeling sad, or feeling depressed, and even increase in terms of anxiety. So we know that these women who have these disorders, it's difficult for them to have a fulfilled family, friendship life, or even work life because your mood is so affected.
Dr. Summerville, when would you suggest that a woman, at what point do you think that they should get tested for this syndrome?
As soon as they think that they have any symptoms. A lot of women, though it is common for about, say, 70 to 90% of women with PCOS having irregular cycles, some may not. So if women who even start their menstrual cycle in puberty find that they just gain weight quickly, have difficulty treating their acne, find that they're always irritable, always sad, anxious, it's good to go to your doctor, ask them for a pelvic ultrasound, which will notice the cysts on their ovaries, and also ask them for certain hormonal blood tests to see if they may have some irregularities with their hormones.
Okay, and so look for those symptoms. We come to you, the doctor says, okay, you have PCOS. What do we do after that to treat?
Okay, so the main thing that many doctors do is give birth control. As I said, this regulates the period. It is not a cure, but it helps women to at least shed the lining of their uterus to prevent further complications, let's say endometrial cancer down the line. And some women as well, if they're overweight or if they're trying to conceive a child, they may be also given metformin if they find that they may be at risk of developing diabetes. So those are the two medications per se that are usually suggested, but usually it is to increase activity, any exercise, yoga. We're actually going to be having a live Instagram of exercise on our PCOS 1 in 10 JA site this evening. And you can also help in terms of your diet. So that is increasing protein, reducing carbohydrates, and increasing vegetables as well.
You're on a mission now to raise awareness about PCOS. Why is this so important?
Well, for us, we find that it's so common. It's so common, however, so underdiagnosed. As we started off saying, about 1 in 10 women. So even now, it is said that it's actually about 1 in 7 women that have PCOS. But, you know, we're not diagnosing it because we either think that, hey, these symptoms are just normal, or we don't probably see a problem with it until further down the line, we may have early diagnosis of diabetes or possible infertility. So it is really important for us to talk about.
I find we normalize struggle in this country as women, eh? If your periods are crippling you, boy, it's just cramps and that's how it go. If you're not seeing it, boy, you know, we never realize that half of these things are diagnosable and need to be treated. So this is a very instructive discussion this morning. PCOS 1 in 10 JA, that's the advocacy campaign that you kickstarted in 2021. You're following through 2022. Tell me a little bit about the Teal Project before we go, Doc.
Sure. It's a teal scarf project. And why we coined it that name is that the teal ribbon is representative of PCOS. So what we're going to be doing is talking to 5 women throughout the month. We have spoken to 2 already, putting out photographs and videos of them just discussing their journeys with different symptoms of PCOS. So irregular cycles, extra hair growth, dealing with being overweight and possibly also having infertility, we'll just allow them to speak on our different platforms on Instagram, Twitter, and YouTube, and different women can see and understand what this journey is like living with PCOS.
And to know they're not alone.
Yeah.
Yes, definitely. Yeah,
Very
it really
important.
helps.
So we have to go, Doc, but tell us again, the symptoms we're looking for. If a woman is watching this now and she's wondering, I wonder if this is me. Tell me some of the symptoms again so she can identify and know she needs to go and get checked.
Okay, sure. If you're having irregular cycles, so less than 9 or 6 periods for the year, extra hair growth on your chin, chest, abdomen, excessive acne, losing hair on your scalp, increasing weight and difficulty taking off weight, and possibly trying to conceive a child for more than a year, and it is not happening for you. So that's something that you should get checked.
Thank you so much, clinical nutritionist Dr. Kimberley Summerville. Now stay with us. We get the affirmations going after this, but first, Danielle Ponder takes us to the break with Some of Us Are Brave. Wow.